the fact that our program has a fairly strong presence in brachytherapy, I knew it was something that practices I would be interested in, as well as disease sites I was interested in treating. I knew they would value this additional training that Fox Chase offers.
Right away from my day of interview, I just knew that from meeting with each of the attendings and meeting all the co-residents, I knew that it's a family environment, and that's what I was looking for. I wanted a well-renowned institution that's going to train me well, but also where I'm going to feel very comfortable. I feel like I fit in and I'm part of the team, and that I'll be working in a place where I'll wake up every day and look forward to going to work.
I was drawn to Fox Chase because I just felt like it just had a really family feel, and everyone seemed to really get along and seemed to work together well, and that's the kind of environment that I wanted to be in.
When I was here on interview day, it was very noticeable to me sort of the community feel in the department where, everybody I met, attendings, residents, therapists, the physicists, it was a very sort of open environment, an environment that I felt would be very supportive from a training standpoint, where not only am I going to get great clinical training here, but really a supportive environment for me to pursue any other interests, whether it's things like research, teaching, mentorship, things like that. So
I chose Fox Chase because when I did a rotation here as a med student, and when I interviewed on interview day, I got a really good feeling from the residents. All the residents were really easy to talk to, really easy to get along with. And it's like that feeling that that feeling stood out more for me here at Fox Chase than any other program I interviewed at.
So I chose Fox Chase because I felt like the program was very strong and you got a pretty wide range of experiences within the different cancer sites.
So there were several things that impressed me. First, how much the doctors seemed to care about their patients. They seem to know a lot about their patients, their lives, their families, their jobs, and so on. I really liked the idea that they had real relationships with their patients. The other thing was how well the doctors got along with each other. Everyone was very approachable. I remember I went to a conference and obviously everyone was very, very knowledgeable, but there wasn't a sense that people were really competing with each other. There was a sense that people were working as a team.
I have currently signed a contract to work in the city of St. George in the very southwest corner of the state of Utah. It's about an hour and a half outside of Las Vegas. There's 5 radiation oncologists in the region there, 2 different groups. And, I felt that there were actually 2 job offers in the state of Utah, and they were both in the city. And I interviewed for both opportunities and ultimately was super excited with the chance to work for this group.
I'm currently located in Texas, in San Antonio, Texas, at Brooke Army Medical Center. I'm active duty in military.
I'm currently working at UT Southwestern in Dallas, Texas, in an academic position treating head and neck cancer as well as skin cancer.
I relocated back to my hometown near Scranton, Pennsylvania. So I work in private practice. Our group is Northeast Radiation Oncology Center, and we're located in Dunmore, so about 10 minutes outside of Scranton, my hometown. And I'm also part-time adjunct faculty at my alma mater medical school. So I'm a clinical assistant professor of medicine at Geisinger Commonwealth School of Medicine as well.
So I think the Fox Chase residency prepared me extremely well. Everyone just has a very open door policy, so it's very conducive to learning, because I didn't feel uncomfortable going to any of the attendings. Doesn't matter what rotation you're on, whether it's GU, breast, gyne, lung, all the attendings have a very open door policy.
The residency at Fox Chase really prepared for my current career by instilling me a lot of confidence and responsibility during my training. I think there is a lot of one-on-one relationships that we build as we go through the Fox Chase residency.
training at Fox Chase Cancer Center allows you as the learner to take whatever role you want to play. It requires self-directed learning, but with that, you get to choose how you do that. And I felt that was really advantageous for me because I could carve in my study time around a family life.
Coming from Fox Chase is a privilege because the moment I got to Brooklyn Mix Medical Center, people want to know, hey, how did Fox Chase treat this disease site? How did Fox Chase do it? And it's a neat feeling to know that you might be new, but since you train at a very well-known institution, that people want to know your thoughts and how you would approach an oncological problem right away as a brand new attendee.
One of the things that really stood out to me during my residency training years, and something that actually drew me to the residency program, is just the camaraderie that everyone has in the department. I think everyone is truly working together to care for the patient. And what you will notice is the patients notice this as well. You will hear this constantly, that there's no other place like Fox Chase in terms of the kind of one unit feeling that you get, whether you are training here, whether I'm sure if you're practicing there or if you're a patient there.
The most significant part of my training at Fox Chase, I would say, is that there's a strong feeling at Fox Chase that everyone wants to succeed. People are ambitious, but they want you to be successful too. There are lots of faculty I go to for advice for a number of different reasons. If you want to incorporate basic research into your career, there are faculty to help you. In my own research, I've collaborated with surgeons, statisticians, medical oncologists, physicists, basic scientists, and it's been very rewarding. I also have an interest in healthcare disparities, and I'm currently monitoring an international virtual conference for Spanish-speaking radiation oncologists and medical physicists with some of my colleagues as well. And Fox Chase has been very supportive and encouraging.
What's kind of stood out is really how open the attendings are in terms of being able to approach them for any kind of questions. I mean, especially me, having just started, like a lot of my questions are really, really basic and kind of silly at times. But even working with like Eric, who's the chair, he's been so approachable and very receptive of really any questions I have when I'm working with him.
When I first started as a PGY2, along with my other co-resident, Rebecca, there was no palliative care rotation. And then we had a somewhat inefficient way to do inpatient consults. But then we proposed adding a new rotation just dedicated to palliative care and inpatients. And then our program director was really open to that idea. And then through, a couple of weeks of, back and forth, we quickly got this rotation up and running so that now, like for half the year, we have a dedicated resident on palliative care, taking care of all the inpatients and doing all the palliative care kind of consults. So just like the quick turnaround in how open our attendees were, or how receptive our attendees are to these kind of ideas that really improve a program, it just shows a lot about what Fox Chase is all about.
Additionally, I was kind of attracted to the brachytherapy program here. They do a lot of HDR implants, and having that procedural aspect of radiation oncology was very attractive to me. And it's kind of nice working with your hands and kind of breaking up some of the day in that way.
And really the emphasis on resident education. So it's clear that the priority is resident education and not simply to use you for work. Any pursuit that you have that's reasonable, the program would go above and beyond to help accommodate that and facilitate that. So I think, our morning lectures, the one-on-one relationship with attendings, and the way the services are structured, really everything is paramount and focused on resident education. So I feel like all of the time spent in clinic and at the center was really valuable educational time.
I was targeting the southwest corner of the state of Utah in a small retirement town where my family lives. And all along the way, they put me in touch with different attendings, different institutions at conferences, and really helped me target this geographic region. And ultimately, about 3 or 4 months ago, signed a job to return to that community, and I couldn't be more excited.
The Fox Chase Radiation Oncology Department helped me with my job search a lot. I think it starts from early on, just helping with, trying to find things that you're interested in and giving you the opportunity to kind of pursue whatever that you want. Not everyone is interested in research, but like if you are like me, there's plenty of opportunities to do research within the department. We have many research-driven attendings who are more than happy to work with residents and or medical students. And there's opportunities to pursue research outside the department, and I did both. So that was very helpful.
The faculty and program directors were all above and beyond in terms of being able to facilitate connections. So when I went to conferences, I was able to meet new faculty that were facilitated by current faculty at our program. And, very often I would get texts and emails from Dr. Weiss about different job opportunities. So even though I was set on going back to my hometown, I also felt that I had a good, thorough support network at Fox Chase should something change.
Yeah, I think one thing I want to tell future residents is that trust your gut feeling. I think that's very important. You'll know very quickly when you walk into an institution, or in 2020 with COVID, if you do a Zoom meeting, pretty quickly the culture of the institution. So trust your gut feeling. The culture is very important, and you're going to do just fine.
I think what I would want an applicant to know about Fox Chase is how awesome the program is in terms of really kind of supporting you in any way that you need to learn. Like, for example, I wanted to do a dosimetry rotation because I thought that would really help me. And I just asked, and they made it happen for me. And that's really cool that they kind of just support you in anything that you want to do.
But trying to get a sense of the culture and how the residents interact with the attendings and the other staff. And I think that, I look back very favorably on my time spent at Fox Chase and the culture. And when I think back to the interview day, I think they did a really good job instilling that culture. And I found that my 4 years in the program were very much reflective of that good feeling I had on my interview day. Again, with the virtual interviews, it might be a little bit hard to do, but I'm hopeful that this video, as well as being able to hear from some current and former alum, would be able to instill that sense of culture that continues to perpetuate.
I think there was always a concern when I'm interviewing, like, oh, is the program just showing, the best side of them? Are they just kind of putting on an interview day for us? But I guess being here now, I've realized that sort of all the thoughts that I had on interview day, things like where, I saw that the residents were happy, the attendings are happy, they're open. All of that remained true.